Okay, on to quiz 9. Quiz 9 covers chapters 32 and 33, along with the psychological first aid PowerPoint and lecture, that triage lecture that I posted. And there were also a couple of supplemental articles for that section. This is a very important part. This is definitely where we're getting into what do you do when a crisis event occurs? What do you do when you see a child that needs some of that support that we need to be able to offer as educators within a school setting. The class average was pretty low for this quiz. It was a 7 out of 10. And scores ranged from a 3 out of 10 to a 10 out of 10, with the majority of people, 1, 2, 3, 4, 4 people getting an 80, and 1, 2, 3, 4, 5, 6 people getting below an 80. So, like I said, this quiz was a little rough, and we'll talk about some of those questions. But once again, somebody got a 100, so I know that those questions were there, and the answers were accessible throughout the readings. So this kind of ties into what I said for our last quiz, but question 1 says, every child who experiences trauma will need outside professional help. This is false. Everyone got that right, but this goes right along with saying always and never. Every child. We know that that can't be true. I need to get to the right page of my book. I'm still on chapter 22 over here. So let's get over to 32. Okay. So select all of the following disorders that may result from traumatic experience. This is in chapter 32, and that identifying psychopathological responses. The chapter talks about a number of different disorders by DSM criteria that may result from a crisis situation. Post-traumatic stress is one. It's on page, it's one of those trauma and trauma-related disorders. On page 616. Acute stress disorder is also one. So it's dysthymia. Dysthymia is just kind of low depressive symptoms that are not quite as severe, that last for a long time. Adjustment disorder and major depression. Those are the ones that can be the result of a traumatic experience. ADHD is not. You cannot identify with ADHD following a trauma experience. ADHD is a behavioral inhibition disorder. You're not able to inhibit your behaviors. And that is a neurological deficit, not something that can be caused by a crisis event. A traumatic brain injury, that is caused by a physical event. So that's caused by, a car accident or something like that, where you actually have trauma to the brain. And then a specific learning disability, that is also something that is neurological in nature. All three of those are neurological and not necessarily an experience to a traumatic event. But that is where you have a specific area, whether it be reading, writing, or mathematics, that is lower than your achievement and skill ability. Your achievement levels are lower than your cognitive ability in that one area. So those three are not typically disorders that can result from a traumatic experience. Question 3. List 3 referral sources from the text. And so if we flip over a couple pages, it has this nice section called Referral Sources on page 622. And the text list primary care physicians, master's level therapist, at minimum master's level, and licensed clinical psychologist, and a child psychiatrist. And those are the 4 referral sources that the text talks about. Question 4. Teachers should approach a crisis event as a teachable moment in order to help children process the crisis in a healthy manner. This is true, and everyone knew it was true. So we'll move on. But that would be in that treating psychopathological crisis responses. Or it talks about how teachers should address those within their class instead of, freaking out and acting like it's not going to happen or not talking about it. I know that after the parade accident at homecoming a couple years ago, a lot of the elementary schools in town chose to not talk about the crisis event, and that was detrimental to a few students who felt the need to talk about it, who were there, who saw it, whose friends were in the hospital. And so teachers could have taken that opportunity to teach the crisis and show the children how to process it in a healthy way. Question 5. What is the purpose of psychoeducation? Psychoeducation is talked about on page 641. And the answer is all of the above. We want to identify warning signs. We want to normalize and validate that stress reaction. And we want to give the individual factual information about supports that are available to him or her. Question 6. Who is responsible for providing psychological first aid? There were a lot of answers to this one, but it is from the psychological triage PowerPoint, and the correct answer is it is anyone, any caregiver who discovers an individual in psychological distress. So in a school system, this means it is on the teacher, because the teacher is the caregiver. It's on an administrator. It's on the people in the offices, just the faculty, everyone. In fact, it could mean that if you're at a park with your kids and you see a kid that is crying and there's not a parent in sight, that is your responsibility as a caregiver to go and interact with that student. So anyone who has the ability, any caregiver who has that ability, has not necessarily a legal but an ethical obligation to go and help that child. And then it doesn't just refer to children. So if you see a woman, an adult who is going through psychological distress, you have those skills and those abilities to go and meet them where they are. Which goes with what's the mnemonic device for psychological first aid and what do the letters mean? This was also from our PowerPoint and lecture. The mnemonic device is meet you, and it stands for making that psychological contact, exploring the dimensions of the problem, examining possible solutions, assist in taking that concrete action, and then finally it requires a follow-up. Question 8. This is from one of those supplemental articles, but Listen, Protect, Connect is potentially effective as a school-based intervention of psychological first aid. And that was true. The article found some support saying that it was potentially effective, but not enough to say that it is best practice. Just saying that more research needs to be done there. And then finally, question 9, there is a clear distinction in the literature between a safety plan and a crisis plan, and they never mean the same thing. This was really split in the class. 5 people said true, and 6 people said false. So I want to go back and look at exactly what we're looking at. This is in the history of school safety and psychological first aid for children paper. And if we go down, maybe, if I can find it, I think it's on this first page, maybe. Let me look. It's on the second page. But on the second page it says state and federal education agencies typically use the term safety plan rather than crisis plan. However, professional organizations, they use whatever terminology is in their field, but regardless of what terminology they use, the crisis plan, this is what the paper says, regardless of terminology and professional alignment, crises in schools are highly impacted by the nature of resources available. So basically what that's telling us is that there's not a difference in the literature between a safety plan and a crisis plan, and that often schools will use those terms interchangeably. It may be called a safety plan, but for the purposes of this class, it would be their crisis plan. It would be what they would do in the if a crisis were to occur. So the correct answer was false. There's not a clear distinction in literature between a safety plan and a crisis plan, and they do often mean the same thing. If you read something differently or interpreted that different, I am open to listening to what you have to say, but that's my understanding from the article of what that means, that those terms can be used interchangeably. So that is quiz 9. Was that quiz 9? Yes. That's quiz 9. Once again, for these, definitely look at those tiered levels. These chapters are super important and super application based, and so I would definitely be looking at these for some of those things that you're going to have to write for your essay portion of the test. But in chapter 22, you have these disorders, and so knowing what they are and what they look like and how to identify one from another, especially anxiety versus depression, what the differences are between those. And then being able to use some of those assessment strategies with the clinical interviews and the rating scales, things like that. What steps would you take identifying a student that may have a problem? And then who you might be able to refer them to. So I would definitely look at that. And then that's just identifying. And then for the treatment section, this is what your psychological triage videos were about. Meeting that person where they are, asking those questions. Be familiar with Bronfenbrenner's model of development. We've talked about that before. It was on our last test. It's been very important throughout our entire chapter, or our entire time studying this topic and this book. And then I would also definitely look at, what that normal response versus that psychopathological response, and what is different and what elevates that response up to that psychopathological level. And I'd be able to talk about that in an essay. And then looking at some of those crisis interventions, tier 1, 2, and 3, and being able to differentiate when you may be able to move the kid up or down, and what levels of support they would need at each area. So look at that when you're studying these chapters.